Hello, everybody. I thought I would do a little update on my recovery for my inspired device surgery and talk to you a little bit about what it's like 4 weeks out for me. I don't know if I'm a typical patient or if I'm a little abnormal. I don't know. But excuse me. But I thought I would start with, I'm just going to start at the top and work my way down. Um, so 4 weeks out, the first thing is how's the pain? So the pain is definitely much diminished. Mostly when I go throughout my day, I'm not noticing things unless I, move weird or try to lift something up that's too heavy. Um, Here's my incision. It's looking really good. It's pretty much blending in with my neck, and I don't feel like people are staring at me like, "What happened to you?" So that's nice. There is, I'm not sure if you can see right here, and then a little down here compared. So you can see it's still a little swollen right there. Um, I'm not doing any ice packs or anything anymore. I think that's just because this is where the implant is attached to my hypoglossal nerve. And there was sort of widespread numbness initially, but 4 weeks out, so a month out from surgery, the numbness is just, it's very localized. It's like right here, right where the device is. Um, so my chin doesn't feel numb anymore, and I had a little numbness even all the way back to my ear, and that has resolved itself too. So I fully expect that as I get farther and farther away and heal more, that the swelling as well as that numbness will resolve itself with the nerve, depending on how you heal. I've had some nerve stuff before, and it just takes me a really long time for to heal from any kind of nerve issue. So my expectations are fairly low. I'm not like pushing hard for stuff, and I fully expect that for this to fully be internally healed, that it'll probably take a couple of months, and I'm okay with that. It's not distracting enough that I'm preoccupied by it every single day. So the healing process is long, and that's okay. This isn't a scraped knee. This is a big deal. So, um, so the incision itself is still a little bit tender, but I've been able to apply an ointment to help with to minimize scarring. So that's been nice. I've been able to return to um, my skincare routine and use the products that I use, and so I've been able to do that. I also, which I know a lot of people who get the device implanted, they're like, CPAPs, I'm done with it, no more. I have actually started using my CPAP again as I've been able to. I have a full mask, and I just find that I still have sleep apnea. The device isn't turned on, and I want to make sure I'm getting as good a quality of sleep as I can, because I don't get good quality sleep anyway. So I typically wear it for about 4 hours a night. So I've never been so, obviously I got the implant because CPAP is just a miserable thing for me. But in the interim, before it gets turned on, I still want to make sure I'm being healthy, and my doctor said it was fine, and it's no longer causing, like, I don't have pain that would cause me to not use it. So I'm using it. Um, don't really want to, but I am. So that's this. You might notice that I still have a little bit of a speech issue. So I'm still, because of this numbness, I'm still experiencing on the right side that temporary paralysis of my tongue. And, this is all muscle in here that's controlled by this nerve. And just like if you sat on a wall and did squats for 10 minutes, your thighs would start shaking. You'd have a hard time walking around. The more I talk throughout the day, uh, the more labored my speech becomes. But also something I'm not super concerned about. I've been able to eat, pretty much gotten back to eating most of the things that I was eating before. Um, it takes me twice as long to eat because it just takes me longer. I have to take smaller bites and chew a little bit more. It's just a little bit more labored. Um, and then swallowing, I can't. I suppose it's not a bad thing that I'm not like horking my food down like I used to. So, um, taking things a little bit slower, not a bad thing. I've noticed that right here, where the end of my incision is where I will get any pain that might develop throughout the day, depending on how much I'm talking or not, or it's raining outside, whatever the criteria are for causing pain. But it'll be like right here. And so that right there kind of feeds into my ear. So I still am getting occasional inner ear pain, which just feels like an earache, I guess. But it's not constant. It's just due to however much I'm using all of this. Um, the headaches have diminished almost completely. So now I have just a little discomfort here as the day wears on, which will feed into my inner ear. So if I'm gonna have pain, it'll be like just around this ear area. Um, Nothing, alarming or anything like that. Again, 4 weeks out from surgery, that's just a month healing time. They tell you 6 weeks. So I still have 2 more weeks of um of just recovery until I go into my pulmonologist. I do have another appointment with my ear, nose, and throat surgeon to have him address whatever this temporary paralysis is. I have no idea if it's gonna delay turning on the device. It he hasn't said one way or the other. So I still have a couple more weeks before I'll go in and see him, and then I see the pulmonologist right after that, and we'll figure out whether or not the device is supposed to get turned on. Okay, so that's all this. Um, I have found just a little tip. I went and got a water pick because if you end up dealing with this temporary paralysis thing, um, food just kind of floats around in your mouth a little bit, and so using the water pick to help clean my teeth has been really awesome. I can't believe I didn't have one before this. It really helps clean everything out of my teeth, and then I don't have to try and dig in there and floss. And it so little tip if you want something for Christmas. It's not a very glamorous, sexy present, but the water pick's been great. And they have all kinds of different attachments too for helping to clean in your mouth, and I've just found it really helpful. Um, okay, so down here by the device, I'll show you the incision. There it is. So you can see, looks pretty good. It's very clean. Again, I'm putting the, scar diminishing ointment on there. Um, so with this, as I have increased my activity level, I have noticed this more. And I'm sure that it's just because I'm using this muscle more and there's a device in there. And so I'm feeling it more. I did have an experience where it moved on me when I was sleeping and it kind of popped up a little and it went right back down. But I went and talked to my doctor about it, and he said that it is not unusual for the device to have some, little bit of movement in there as your body is healing around it. And so the tissue has to grow around that device. And I suspect, like, by next year, I probably won't even notice it at all because my body will have just sort of made it part of me. But right now, in the interim, I have been more careful about, I guess, just when I sleep, certain positions, like on my side or whatever. I try to make sure that I maintain sort of a flatness with this so that it doesn't move, because I'm sure the more it moves, the longer it'll take to heal like that. Um, Overall, I'm still glad I did it. I'm really excited to get the device turned on and get to a point where I feel much more liberated from the CPAP machine. Um, I have had to be more patient with myself and lower my expectations for recovery a little bit. I think that there's a lot of cheerleading going on, which is fantastic from the company and other people that have had this. And um, I think this is groundbreaking technology. I can't believe I live in a day and age where I can have something like this that could help maintain my health so profoundly. So I'm glad for that. Um, but I would, if I had any advice to give anybody, all I would say is prepare accordingly. This is a major surgery. It's not a procedure. It's it's a major surgery. It's not like getting a mole removed or something. And so prepare accordingly your timing. And I would also say not necessarily lower your expectations, but have reasonable expectations for recovery and know how you heal. You likely have lived long enough to have been scraped and bumped and injured at some point in your life, and you can determine how quickly you're going to heal. The older you are, the longer it's going to take for you to heal. Um, so the final thing is, in terms of stamina, um, I would say that for me, I'm not at 100% in terms of activity in my life. I'm doing more, uh, picking up around the house. I'm doing more, just sort of normal things like just like dishes, laundry, that kind of stuff. I'm not doing a whole lot of vacuuming. That particular activity is a little like I'm not vacuuming a whole room or whatever. I might just do a little area. Um, and I'm not doing stuff every single day like that. So that's me. But I have plenty of help, and that's good. I've been walking my dog. I've been folding laundry. I'm just trying to think of just sort of mundane things. I've been driving. The first couple of weeks, I didn't drive myself anywhere. If I had to go to the store, I always had somebody take me to go with me, not only to drive me, but to help me lift things. But I experienced some vertigo that has since resolved, which I'm thrilled about. So it took about, I would say, 3 weeks for the vertigo to resolve. And that was just because the eustachian tube that comes down from your ear right here is what, if it gets impacted at all, it can affect it can cause vertigo or whatever. So the swelling right here was obviously something that was a problem for me. But like I said, it's since resolved, and so that's great. Um, and then in terms of any sort of pain medications, um, I would say once a week, I might need to take some Tylenol or something. And it's largely due to just activity level. If I'm like really active, I have a really busy day, the next day I might feel like, wow, okay, I might need a little something. I'm sore. But all in all, I feel like it's been a very interesting process. I feel very privileged to have been able to participate in this kind of surgery, and I am excited about having the device turned on and to see what happens. If you have any questions that I haven't covered, feel free to comment below. Um, and I do have the other video I did, and I think it was like after 1 week I did that video. So yeah, I'd be happy to answer any questions you might have. Uh, Good luck to anybody that does this, and I hope it's a success for you as well.